Hello everyone, this is my initial research problem presentation for AT 621. So while we were in Idaho, I think one of the best lectures that we had about various tools that we could use in our clinical practice was the instrument-assisted soft tissue mobilization lecture by Dr. Baker. I thought it was very interesting, and it talked about a tool that I had previously overlooked a lot when trying to change my clinical practice. So when we left Idaho, I did some volunteer work at the Olympic Training Center in Colorado Springs, and they happen to be very into instrument-assisted soft tissue mobilizations. Most of the clinicians there were Graston trained, and they had several Graston tool sets. So it was really neat to be able to work with the Graston tools and actually get some experience while still working with people that were trained and knowledgeable in the tool use. After I left, I began reading a lot more about instrument-assisted soft tissue mobilizations and its various use in clinical practice, and kind of looking around to see if there was something affordable that maybe I could purchase and start working with. And I remember had one of the other volunteers that was at the Olympic Training Center had mentioned that she had a few colleagues who had tried using the Edge tool before. It was very affordable. It's only a single tool as opposed to an entire set of Graston, so you could travel with it if you wanted to. It's less to keep track of, and still had similar edges, if not all the same edges, as the Graston tools. So searching around trying to find one that was affordable, the Edge tool was definitely the most affordable one that I came across. The stainless steel version was only about $110, and I found it on Amazon.com of all places. So I purchased the tool, I've acquired the tool, and I've kind of been playing around with it. And then I started using it on my own patients in my AT clinic at school here. And I've had numerous chief complaints that I've been using it with: soreness, tissue restrictions, plantar fasciitis, tendinopathy, strains, soft tissue deformities. All of them have had very, very positive outcomes. But I have since need to do a better job collecting outcome data, DPAS data. So while doing all of these types of treatments on patients and stuff, a lot of my colleagues have been very interested in the soft tissue mobilizations with the instruments, and had begged and pleaded for me to do an in-service with them to show them about the tool and how it's worked. So I went over what it was exactly, the history behind it, and how it was created, and why it's supposedly better than just using your hands. Went over indications, contraindications, precautions, all the typical stuff like that. And so we started talking about how the tools can be used in our AT clinic at Mount Union, and discussion began on how we can acquire the tools. And we didn't really want to pay the whole $2,100, $2,500, $3,000 for Graston and all that stuff. So again, kind of everything went back to the Edge tool, and we decided to purchase a few of them here. Then the discussion began, well, what about the plastic versus the stainless steel, and what's the difference, and is there a difference that could change our clinical practice? So that kind of sparked my question: do patient outcomes differ with the use of a stainless steel instrument assisted soft tissue mobilization tool versus a plastic one? And so again, we went online and we purchased the stainless steel model, again because it was affordable. And we also purchased the Agility Tools plastic version, which is also affordable at only $50. Both of them were on Amazon. And so, again, to kind of spark my interest, if this is something that I want to pursue, I feel that I need to become a quote-unquote expert on the tools. And since Graston seems to be the gold standard, then why not get Graston trained? And so there happens to be a course in Pittsburgh in a few weekends that I'm going to attempt to attend. Problem being that we have a home volleyball tournament the exact same weekend, so it's kind of hard to be the athletic trainer in charge of volleyball and be away the weekend that you're hosting your home tournament. But I think we have a plan in place, so it should be able to work. But along the same lines, we still have a couple other clinical questions that are kind of posed with the use of a plastic tool versus a stainless steel tool. A couple of those questions are: is there a difference in sensation between using the plastic versus the steel to the clinician? And is there a difference to the patient? And is that going to affect data? There's also, the question: are there certain pathologies that are going to be more easily felt with plastic versus stainless steel? And is the pure weight of the stainless steel tool too much for patients? Would the plastic be an adequate alternative to provide similar effects that you would normally see with the stainless steel? And then vice versa, if the weight's not enough, could you use the stainless steel without causing more harm than good?